All right, good afternoon, everyone. Bad news, I'm not actually going to tell you which water treatment system is best. But we're going to talk about a cost-benefit analysis that we've done to determine which is best for which particular situation, determined by either policy or private well users. So before I get started, I just want to give a huge shout out to Frida Von Qualen and Emily Berquist at MDH on my team, and Annie Nelson and Tanny Eschnauer, who put a lot of effort into this, mostly being led by Frida. This effort is funded by the Clean Water, Land, and Legacy Amendment that Annie mentioned. A lot of our work at MDH in Minnesota is funded by. And the reason behind this cost-benefit analysis that we are doing is to help build a statewide testing program for private well users, build an argument for that, and potentially even cover some mitigation. Because like many of you in Minnesota, we have limited options available to help with the cost of testing and with mitigation. So the work that I'm going to share today is to help build support for that across Minnesota. So about 20% of Minnesotans use a private well. That is about 1.1 million Minnesotans. Testing and mitigation is voluntary and the responsibility of the private well user. Of course, public water systems routinely test and mitigate for over 90 contaminants. Private wells just don't have these same protections and are only tested in Minnesota once after construction for bacteria, nitrate, and arsenic. And because testing and treatment is voluntary, our work focuses on increasing access to information, testing, and support for private well users. So in Minnesota, our concern is with top 5 contaminants that are listed here: lead, arsenic, bacteria, manganese, and nitrate. These are the things that we recommend that every private well user in Minnesota test for, regardless of where they live. And then if there's anything in particular, in like a spill or like the PFAS situation that you heard about earlier, we recommend additional testing or at least awareness about that as well. All of our grants currently test for the top 5 contaminants, and as you can see, we do find them frequently. We find them across Minnesota. And the good news is there are ways to address each of these contaminants. It's not a technology issue, it is something else. Many private well users we know are not testing, and many who know that they may have water quality issues are not taking action to address it. In previous years at this particular conference, you heard us talk about the 2016 survey of private well households that knew they had elevated arsenic. 34% of those people did not take action to reduce exposure to arsenic. There's a variety of reasons why. Fewer than 20% of folks regularly test their water. And this was also in that same survey, we asked about it. And then in a newer study that we completed or are completing, started in 2025, showed similar results. We all know that mitigation and testing are key to protect private well users' health. So why is there this disconnect? To answer these questions, we use social science. Social science underscores how there are many factors that can affect whether someone wants to address a water quality issue or can, including things like perceived severity of not doing something, perceived benefits of doing something, barriers to doing something even if you want to, knowing what to do, and hundreds of other reasons. We do have some insight about what factors might be affecting people's decisions based on that 2016 survey and that survey that the University of Minnesota is currently working on that started in 2025. Was done by the U of M's Center for Changing Landscapes and included about 1,000 responses from private well users. So a couple more examples. People may not know what the next step is. 16% of respondents in the University of Minnesota study survey stated that they didn't know what they would do if a water test showed a water problem, so they just didn't want to test. 36 respondents in that same survey noted that the potential cost of treatment is a barrier for them to even get their well tested. This mirrors some of those same findings we saw in the 2016 survey. We're using these survey results to help drive the approach for ensuring safe drinking water, including the development of a comprehensive plan to ensure safe drinking water. Annie did a lightning talk about the Drinking Water Action Plan last year, so I won't get into that too much, but we know many of the challenges that private well users face, and we know that there is a large portion of our population that relies on private wells. As such, Minnesota developed our 10-year roadmap and shared commitment for ensuring safe and sufficient drinking water for everyone, everywhere in Minnesota, regardless of where they get their drinking water from. In the Drinking Water Action Plan, we specifically included many strategies and actions that focus on supporting private well users. 6 state agencies and the Metropolitan Council all signed on to the plan, which incorporated feedback from hundreds of people, including water professionals like yourself, and people who just drink water. We invite you to check out the plan. You can grab that QR code and see how private wells are included. For today's presentation, I've picked out just a couple that are relevant to the cost-benefit analysis. And they support the private well users in navigating private well mitigation and testing. Naming the actions in this particular plan has really helped Minnesota drive forward these actions and play into our longer-term strategy for private well users. So maybe something for you all to take back and pick the things that work for you. So the Drinking Water Action Plan identifies financial assistance for mitigation as key to protecting private well users. Right now in Minnesota, there is no clear source of funding or path forward. And we also named a new activity, and this is this cost-benefit analysis. There's going to be 2 phases. We just completed phase 1, which is an evaluation of the mitigation options and looking at cost data as well. The second phase will help us answer what the costs are of providing mitigation either at low cost or free and testing as well, versus the cost of us doing nothing and having higher healthcare costs because of cancers and other things that the contamination is causing. So you can take a look at the report that was generated already by this cost-benefit analysis. So you can grab that QR code. It is on our website right now. And if you do go to that website with the QR code, you'll want to go all the way down to the bottom of that web page and click on the of interest section, and you'll be able to find it there. There's the QR code for you. And so this report covers treatment options, the evaluation of those options, the cost of those options, and then some decision trees to help programs and private well users make decisions about what the best mitigation system might be for their particular situation. All right, I don't see anybody else trying to take a picture. Oh, I was too fast for you over there. All right, cool. All right, so I told you about our top 5, so those are the contaminants that we evaluated: arsenic, lead, manganese, nitrate, and coliform bacteria. You can also see the different treatment options in this chart that Bay West, the company that we contracted with, looked at for each of the contaminants. And we recognize that not all of the treatment options work for all of the contaminants. And so the first thing that Bay West did was go through and say, nope, this doesn't work for this particular contaminant, so we're not even gonna pretend that it does. We're not gonna look at that one. So, for example, well repair and distillation, really those options would only work for bacteria, and nitrate doesn't make a lot of sense to reconstruct a well if you have a naturally occurring contaminant like arsenic or manganese. And then once they had that list that was filtered down a little bit more, they looked at a bunch of the different things that might affect how people use their technology or what's available. So several factors that play into that cost benefit, including if the technology is even available in Minnesota, how easy it is to use, operations and maintenance, waste, costs. And the first time we went through the draft, they had not included convenience, which we were thinking about it as behavior change. So if you go from just having a well and you use the tap water wherever you want, the bathroom, kitchen sink, wherever, and you have to make a change because there's a contaminant, what does that behavior change look like for each of these? And they can vary quite a bit, and that really did impact a lot of the scores that each of these got. So one of the things that you'll notice in the report is a summary of the scores. So there's also details on each of those different factors that played into it, describing why they chose the particular score that they did. And then this summary also, which I am looking at it like someone who is colorblind on my sheet, so I recognize that it's very difficult and not accessible the color-wise, but you should still be able to see the numbers and make sense of that. The higher the number, the better it is as treatment for that particular contaminant. And so that is listed by contaminant. And then they also included a detailed summary rather than the full list of things, so that you could compare different types of treatment for, say, arsenic. You could see how RO compared to other options like anion exchange or something like that right next to each other, including the factors that you can see here. The table looks like this, far too tiny for you to read, but that's what it looks like in the report, so that it's really easy for folks to see okay, cost is a really big concern for me, at least in the short term. What's going to be the least amount of cost that's still a high enough number for me? All right, and this is just a general summary of all the scores so that you can see kind of how the different treatment options compared against each other. Again, the green and the higher numbers are the best options. I'll put that in quotes. And the lower or the red numbers are the least desirable options because the factors didn't score as well. They're harder to use or might be more expensive, that sort of thing. And I want to dive a little bit deeper into some of those notes on how we developed this. Again, with that first draft, we were a little bit surprised to see that bottled water scored really, really well. In fact, it was almost a perfect score. And we know that there's a lot of issues with bottled water, so we thought to ourselves, why is it scoring so well? And that is where we developed that convenience factor, because we know bottled water, even though it can be expensive long term, they recognize that, but they didn't recognize that you need to schedule a delivery time, or you need to go to the grocery store, or you need to figure out where to dispose of the plastic. And those convenience factors, even including remembering to drink bottled water instead of going to the tap, go to your refrigerator or go to the garage and grab a bottle of water, or replacing the thing on the Culligan stand. So once we added that in, that score went down quite a bit. But you'll still see it's one of the highest scoring. And when we dive down into the notes, Bay West noted that is really just a very good short-term solution. And so while the summary is really helpful to see kind of an overall picture, it's really important to understand what are some of the details that are causing these numbers to be better or worse. Distillation also scored really, really high initially. And we were curious why that was, and a couple things that were not caught in the first draft came to light. High electric usage is an issue with distillation, and likely the reason why we just don't see it installed in Minnesota. It's pretty expensive to make it run, and also you need to have that run before you want to drink the water. So a convenience factor also dropped that down. Okay, so we also had them make some decision trees, and this sort of walks you through okay, I have a person who has nitrate. These are, have they tested yet? Yes. If they've tested, then you go to the next one. Was it unsafe? Yes, then you follow the tree. And then you can see okay, do they qualify for RO? Because in Minnesota, that seems to be the best option, so that's what we put there. And if it's greater than 25 or RO doesn't make sense for them, then you go to something else. So we developed these for the top 5 contaminants. We hope there's something that might be useful for you as you develop or talk through those decisions with a homeowner, or maybe someday you'll get to have a mitigation program like we're hoping for. So our goal is to use this for some policy at either the local level or the state level, in addition to potentially homeowner use as well. And so we welcome you to take a look at that. There is a full page. If you turn to the end of my presentation, you should have a full page of at least the nitrate one. And they're in draft form right now. We recognize there's some issues with it at the current moment. So if there's anything with that would make it more useful to you, we want to share that with others outside of Minnesota. We recognize we're really fortunate that we have the resources to do this. So we want to make that available to other folks. So please email us, health.privatewells@state.mn.us, or you can email me with any suggestions, comments on that particular diagram. All right, and then to wrap us up, so that part of our cost-benefit analysis is all done, except for tweaking a few little things at the end. And next, we are working with the University of Minnesota, who is going to take that cost information and compare to the public health benefit of providing free or low-income options for testing and mitigation, and ultimately help us answer if there is a net benefit to providing free testing and income-based mitigation. Hoping to have that complete by the end of 2026, and maybe we'll be able to share that next year. we're really, really excited about this because a similar approach was taken with lead service lines in Minnesota in 2020, where they did a similar cost-benefit analysis. And this helped unlock $243 million in state funds to remove lead service lines, along with a comparable amount of federal funds. And just this last year, I think we're hoping to see $250 million additional dollars this year for that effort. So very, very successful to show this science and show the numbers, the economics behind why we want to do this work. All right. Thank you. I hope there's some things that you can take back. And again, thank you to Frida and the Water Policy Center team at MDH. What questions do you have? That's perfect. All right, can you expand on the lower scores for public water supply as treatment for arsenic, nitrate, and I think manganese? So manganese, there is not an MCL for manganese. So that won't help anybody. I mean, maybe, we don't know because it's not being tested for. Things like arsenic, there could be a variety of reasons. I guess I'd have to look at the report. We do recommend that using the health-based guidelines, like many others who have presented have said they're moving towards health-based guidelines versus MCLs, so it could also have to do with that. In evaluating the cost effectiveness of new wells, did you take into account the environmental health benefits that having a properly constructed code-compliant well has on the long-term aquifer health? That was not something that they took into consideration. As far as I'm aware, they were really looking at like after, but they were looking at, I think I failed to mention that they were looking at like a 30-year cost. So that helped bring down or make the cost of a new well comparable to other treatment options that might look more cost effective in the short term, like bottled water. For bottled water, was there any detail specified about the form that people were imagining it in? Large multi-gallon dispenser jugs, bulk grocery size bottles? Not really. I think they were assuming that most people would be getting the Culligan large, 5-gallon jugs. But as we imagined it, in reviewing, we thought that people may also choose to go to Walmart and purchase, little ones. Also, especially if they did not have the time or availability for a Culligan jug to be delivered to their house. That was definitely a barrier. So it didn't specifically spell out both options, but I think if you take a look at the report, it's inclusive of both in how it's written. From what you saw, do you think that the flow chart or people's responses would change based on whether they knew or didn't know the source of contamination? It depends on the contaminant. So thinking about nitrate, or even bacteria, if there is a visual on the well where we can see that some sort of contamination is able to get in, then yeah, we would determine, and hopefully the flow chart would help us determine that RO is not going to be the best option in that scenario, because we can see that there's a problem that could be addressed in a different way that is better. When dealing with real humans, What if they don't want any more government involvement after an elevated MCO? They don't have to do anything. It's all voluntary. So they can get it tested if they want. They don't have to get it tested if they don't want. It's all still voluntary in Minnesota. Have you considered evaluating the use of water coolers that take refillable 5-gallon jugs? Yes. Yep. A comment from the PWC team to everyone. There was a printing error, so we had to switch out the nitrate decision tree. If you don't have a properly scaled decision tree in your binder, let one of the private well class members know. Thank you so much.